Thousands more are willing to roll up their sleeves, but many are being left out in the cold, both literally and figuratively. Maleeha Sheikh has that story for us tonight.
It turned out to be a frustrating day for people trying to get a booster shot or tested for COVID-19 due to long wait times. Ontario's top doctor was supposed to make an announcement today regarding changes to testing, but it was postponed, only adding to the frustration.
I've been waiting for about 2.5 hours. Here's the number I got when I first got in line. It's around 12:30 now. Unfortunately, we've all been waiting in line for a long time.
People had to clear their schedules today if they wanted to get a shot. This was the scene at 2 vaccine pop-up clinics in North York and East York.
People are standing since 2.5 hours. It's not so easy for us to stand in cold winter, and many people came unprepared for this wait time.
I think I'm gonna feel better and more safer, but getting the vaccine is another story.
Premier Doug Ford was touring a vaccine clinic at a HelloFresh warehouse in Peel today. Here's what he had to say about the vaccine rollout as people attempt to get their first, second, or booster shot.
We've had a couple slow days at Christmas, but we're world class when it comes to vaccine rollouts. We'll be hitting up to, our goal is 300,000 a day.
Torontonians have been voicing how it's been difficult to get tested as well. There were lineups at multiple testing sites in the city, like Women's College Hospital. From December 20th to 24th, Ontario averaged 57,900 daily tests as the percentage of positive infections surged in the 18 to 24 age group. This has forced Ontarians to seek alternatives as residents have reported difficulty booking COVID-19 tests. Ontario's Chief Medical Officer of Health, Dr. Kieran Moore, was expected to speak about the province's case management, contact tracing, and updated testing today. But the Minister of Health's office released this statement. In light of the recently updated guidance from the Centres for Disease Control and Prevention on shortening the recommended isolation and quarantine period, the Office of the Chief Medical Officer of Health and Public Health Ontario are evaluating this guidance against Ontario-specific evidence. Dr. Moore will provide an update later this week. 1 week ago, Dr. Moore hinted Ontario was preparing to change its preemptive approach to testing and contact tracing due to strained resources. Another big concern right now is schools. Will they be opening up for in-person learning next week as planned? We asked Ford about this, and he simply said both the Education Minister and Health Minister are discussing this, and there should be an announcement in the next couple of days. For City News, I'm Maleeha Sheikh.